Welcome back, everyone, to our health assessment course. This video is designed to go over your written paper health assessment that is due here in week 7. To find this assignment, if you are on Moodle, you're going to scroll down here till you get to week 7, and you will see right here is where all of this work is going to happen. Your learning objectives are here. The activity and assessment is here. In this folder, the comprehensive health assessment assignment, the supporting documents, if you click on that, you will see that the template that you will fill out with your health assessment, that is the first document here. And then I'll talk about this in a few minutes. If you are not a practicing nurse and you need a simulated patient, both of those case studies can be found here in that comprehensive assessment supporting documents folder. If I go back out here to week 7, so we were just here in this folder, right here, this pink piece of paper, that is where you would actually upload your assignment. And I'm going to pull over here our course syllabus because everything that you need to know requirement-wise about this assignment, remember, is at the bottom of your syllabus starting on page 17. So I have that pulled up here for us. So we have two options here, option A and option B. Option A would be for those of you who are currently practicing as nurses. You would be able to select a patient from your current clinical practice, and you would complete your comprehensive health assessment on one of those patients and then analyze the assessment process and findings. Please make sure that you're maintaining HIPAA compliance. So that would mean if you're taking care of me, Beth Boyd, you would never say patient Beth Boyd. You would use my initials, BB, or I am even open if want to say that you have given your patient, you took care of, a 37-year-old female, and you've changed her name to be Susan for the purpose of this patient. Or again, you can just simply use first and last name initials and use that throughout your paper. But please don't provide any identifying information about your patient that you utilized. If you are not currently practicing as a nurse, then option B is for you, and that is where you are going to use that simulated case study for your assessment purposes. So back where we were just at on Moodle, that's where you would pick either patient A or patient B, essentially, and use that information to complete the assessment documentation. Your learning outcomes are here if we scroll on down. So the first part of your assignment is the clinical practice assessment. So if you are a practicing nurse doing option A, choosing a real live patient, you're completing that comprehensive health assessment, which is the first document in that supporting documents folder. You're going to go through, fill that out on the patient of your choosing, making sure you're documenting all of your findings, integrating at least 2 technological tools in your assessment. So if it's a mobile health app or diagnostic device, anything like that, you need to include 2 of those. If you are utilizing option B because you are not currently practicing, you're using your case study to fill out that same form that we talked about and using the information that's in there. So option A is an adult patient with type 2 diabetes and hypertension, and option B is an elderly patient with early stage dementia and mobility issues. You're going to do your assessment. You're going to give me what you would think would be the appropriate order of the assessment, the findings that you would anticipate knowing this information and looking at the information that is provided to you. You would document your plan assessment using the simulation template that is in that folder. And then you would integrate at least 2 technological tools that you could use in this assessment. So pretty much you can pick what you would want, whereas our practicing students, you're utilizing things that you actually are able to utilize or did utilize in your assessment. So that is that first piece of the assignment. Then from there, you are writing an analytical paper. So you are writing a paper that is analyzing your assessment process and findings. So for option B, students focus on your planned approach and anticipated findings as you move forward with writing this paper. So there are a total of 6 sections. We have the evidence-based practice section. That is worth 10 points, and it spells out each section as you see. Let me just scroll down here to page 2 so that you can see that. I promise each section has exactly the points that you need to discuss and hit on. Option B students, you will see that each one of these has a separate section for you explaining like how you should look at this, think about this, since you are not utilizing a real live patient for this assignment. So please just make sure that you are looking, at each of those bullet points. If you keep scrolling to requirements, you will see that we do want to focus on quality over quantity. You do have to have a 5-page minimum, but you should not exceed 10 pages. When I am looking at page requirements, title pages do not count towards your minimum and maximum, and neither do your reference pages. So you should have at least 5 pages of what I like to call meat and potatoes. I want a full meal, full 5 pages at minimum with that information. And then, any appendices, reference pages, title pages, that is all above and beyond. Please do make sure you are following APA format 7th edition. And remember, under our course resources, there is the link to the Purdue OWL. You need to have at least 3 scholarly resources that are dated within the last 5 years for this assignment. Please use clear and professional writing. Integrate things that you have learned, terminology, processes that you have learned throughout this course. And again, please maintain HIPAA compliance with all of your patient information. You should be submitting both the health assessment documentation and the analytical paper in Moodle, including all your references and appendices, and it is due per our course calendar. So basically at 11:59 p.m. on Saturday of this week. There is a rubric following this. Each section is going to be looking at the depth of the analysis, integration of your evidence, professional writing, application, and critical thinking. So we're going to look here at the rubric. Please make sure that you are citing your work appropriately, that it is original. Remember, AI is not permissible, and plagiarism will result in course failure. All right, here is our rubric. It's on like a spread of 2 pages, but about 1.5 pages in length. So here's a secret. I follow the rubrics. Like to me, they're kind of Bible for the assignment. So when I am looking at each one of your work, I will pull up a fresh rubric for each of you, and I will go through and look for whatever section I'm in, look across the rubric, read what you've done, and go from there. So if you're like, I want to make sure that I get 30 points on my health assessment, well, then I need you to submit to me a full health assessment with thorough documentation of all body systems, and at least 2 of those technological tools are included. Again, if you want full credit for evidence-based practice, we need those 3 evidence-based practices that are discussed with a thorough analysis and that you have your references. I will also be using this, if we scroll back up here to these numbers 1 through 6 in these bullet points, like I'll also be kind of ticking off and making sure that each of those was included as well. So when you get your rubric back from me, typically what I do is highlight. So, if you had 30 points, I would highlight that whole section in yellow or orange or whatever. And then you would know, okay, I got exemplary in this category. I got fair in this category, and you'll receive that back. You'll have your total points written down here with some comments. I do like to, when I go down through the paper, add my comments off to the side in Word documents so that you can see, if I'm praising something that you've done, you can see exactly what it is that I'm really liking. If I'm giving you feedback on how to improve or change something, again, you'll see exactly where I'm at. So most of my feedback is integrated into your paper. So don't be surprised if on the rubric itself you see what your total points were out of 100. And then I say something like, please see comments embedded within your paper. If you have questions or concerns about anything that I have noted on your paper or in your rubric, please don't hesitate to reach out to me so that we can have a conversation about that. And this assignment is due, let me just scroll back up here, by Sunday, June 15th at 11:59 p.m. unless you have reached out to me beforehand and made a prior communication and we have set something else up. And then you still have one more week of work to do after this. And remember, week 8 ends on a Saturday, not a Sunday. So week 8 is ending on a Saturday, not a Sunday. That's just like a little disclaimer because I know that sneaks up on us. All right, this is your one and only written assignment. Please don't hesitate to reach out to me if you have any questions or concerns. I am here and to help and happy to do so. All right, happy writing. I can't wait to look at all of your assessments.